Yes, so a very good evening to all of you. A warm welcome to this DBMCI pharmacology lecture. So, guys, we are here for this pharmacology lecture, and we're going to start this new batch of Dental 2025 entrance exam. Yeah, so I can see there are many students who are online. So, Dr. Aprajita Das, Dr. Shilpa Kajal, Dr. Nimesh. Yeah, a very good evening. So, guys, like this session is free for all. Like this is open to all, and anyone can watch this lecture on YouTube also. So my technical team, marketing team must have shared that link with you people on which you can watch this video directly. So does not matter whether you are a registered student or not a registered student, does not matter. So this is free for all. Yes, I can see there are many students who are online. Dr. Samira, Dr. Jyoti Rana, Saurabh Basu, Dr. Charmi, yes, Dr. Ninama, yes, Dr. Ranju Malika. A very good evening to all of you. So, guys, we people have come here for pharmacology lecture, and like as you must be knowing, we people have decided to start our lecture with autonomic nervous system, right? So, I'm here with you on this YouTube link, and also I'm also reading your chat. So, in case you people have any doubt during our lecture, in this first session, I will be there online with on this YouTube chat. So you can directly place a message, directly put a message on this chat. So I will love to reply to your queries. Yes, Dr. Kushi, a very good evening. Dr. Tanvi Vats, a very good evening. Right. So guys, uh, pharmacology, you must be knowing like it's all about the dealing with the drugs. And I know you people are surgeons, so you would be requiring less number of drugs to prescribe in your clinical practice. But still, like if you have a good knowledge of drugs, then any doctor who has good knowledge of drugs and how to prescribe them, it's always be beneficial for you for your clinical practice also, right? Yes, Dr. Shrishti, Dr. Lalita, a very good evening. So guys, can we start now? I think enough people have joined. So approximately 100 people have joined us. Okay, 70 to 80, like the count is fluctuating. Okay, yes, Dr. Gautami, good evening. So guys, starting with autonomic nervous system. So if I ask you this question, what is autonomic nervous system? The answer would be autonomic nerves are those nerves that will supply our involuntary muscles, right guys? So autonomic nerves are those nerves that will supply our involuntary muscles. So here you people have to answer me one question. Which muscles of human body are involuntary muscles? So I have said that autonomic nervous system is the one that starts with the word autonomic, right? So autonomic means something is automatic, right? So autonomic means something is automatic. So that automatic thing is our involuntary muscles. So the muscles which are not under our control, supplied by a set of nerves, and those nerves are known as autonomic nerves. So here you people are supposed to answer me this question: which muscles of human body are known as involuntary muscles? Very good. So Dr. Nimesh Ambu has given the answer. It's cardiac muscles. Yes, Dr. Mosami has joined us. Dr. Me Side Dento Club. Yes, Dr. Supriya, Dr. Shilpa. Yes. Yeah, thanks for the answer, guys. Your answer is absolutely correct. So we have smooth muscles and cardiac muscles. Yes, Dr. Maninder Kaur. Yes, cardiac muscles and smooth muscles are involuntary muscles. And who would answer me like which muscles are voluntary muscles? So if you people have answered me this question, that smooth muscles and cardiac muscles are involuntary muscles, then my next question is which muscles are voluntary muscles? Anyone would like to answer? So which muscles are voluntary muscles and what we call those nerves, like the nerves that will supply our voluntary muscles? What is a special name given to those nerves? So autonomic nerves are those nerves that will supply our involuntary muscles. That's one thing. So we have a different set of nerves that will supply our voluntary muscles. So here you people have to answer me which muscles are voluntary muscles. Yes, so your answer is absolutely correct, guys. It's the skeletal muscles. Skeletal muscles are voluntary muscles. That's very good. And what we call those nerves that will supply our skeletal muscle? Any name you know that from your physiology? Any name, any special name we give to those nerves that will supply our skeletal muscle? So the answer is that somatic nerves, right? So those nerves are known as somatic nerves, And like this system is autonomic nervous system, that system is somatic nervous system. So that system is somatic nervous system, right guys? So, like, let's start with this discussion, the basics of our nervous system. So, everything in human body is controlled by central nervous system. This we all know. So, everything in human body is controlled by central nervous system. Like in our laptops, we have a CPU. Similarly, our body CPU is central nervous system that will control everything. So, this includes our brain and spinal cord. So, brain and spinal cord are the two important structures that controls each and every aspect of our body. Now, central nervous system is the one that will also control our peripheral nerves. So, central nerves are those nerves, centers of our CNS are those centers that will supply, that will also control our peripheral nerves. So, CNS is the one that will also control our peripheral nerves, and the system is known as peripheral nervous system. So we have a central nervous system, we have a peripheral nervous system. So very simple guys, any nerve that is present in brain and spinal cord is known as central nerve. And if that nerve will come out of brain and spinal cord, the nerve is same, the nerve is not changed, but the name of the nerve will change as per the location. So as per the location, the name of the nerve will change. If the nerve is started in CNS, because all the nerves are connected with CNS, so as long as these nerves are present in brain and spinal cord, we keep on calling them central nerves. The moment they will come out of brain and spinal cord, we start calling them peripheral nerves. Now, if I ask you this question, how many types of peripheral nerves we have? The answer would be there are two types of peripheral nerves we have in our body. So we have total two types of peripheral nerves in our body. So students who have already joined us, students who are already our regular batch students, you people must be having our class notes, right? So class notes books are with you, and all these notes are already given in those books. So in case guys, like you don't want to write, like I know that these days the people are very smart. So these days people don't want to put so much of effort in writing and just mugging up everything. So what you can do, you can also follow those notes in case you want, right? So it's only option to you. But my personal suggestion, like this is what I used to do when I was a student. I always used to write my own notes because once I make my own notes with my own hands, it's easy for me to remember them. It's easy for me to have a pictorial memory of those notes in my mind. So it's always better to make my own notes because everyone has different style of reading. Everyone has different style of writing. Everyone has different way of remembering the content. So it's always better if you make your own notes, but the shortcut is you have the notes with you. So in case you want to follow it, you can follow that also. So guys, CNS is the one that will control our peripheral nerves. That is what we have covered. Now we have two types of peripheral nerves in the body. One is known as sensory nerves and second is known as motor nerves. So we have two types of peripheral nerves. One is known as sensory nerves. Second is known as motor nerves. So first type of nerves are the sensory nerves. Second type of nerves are known as the motor nerves, right? So if I talk about the sensory nerves, again, if the sensation will come from voluntary part of the body, that is known as somatosensory. So that component is known as somatosensory. Somatosensory nerves are those nerves that will carry sensation from voluntary structures of the body. And the second is known as autonomic sensory. Second is known as autonomic sensory. It means the sensory nerves that will start from our involuntary structures of the body. Right? Similarly, guys, we have a motor nerves. Motor nerves can be two nerves, two types of nerves. One can be somatic nerves, one can be autonomic nerves. Right? Somatic nerves, somatic motor nerves are those nerves that will supply our voluntary muscles. These are the nerves, are those nerves which will supply our voluntary muscle. Like you people have already mentioned, one of the example of voluntary muscle is skeletal muscles. So one of the example of voluntary muscle is skeletal muscles, right? And autonomic nerves are those nerves that will supply our involuntary muscles. Autonomic nerves are those nerves that will supply our involuntary muscles. And we people have also covered, like you people have already answered, that our cardiac muscles as well as our uh, smooth muscles, right? So cardiac muscles and smooth muscles are involuntary muscles. But you people are dentists. You people deals with our the facial health and as well and everything that deals with our dental, oral hygiene and everything. So guys, can you please answer? Like if I ask you this question, facial muscles belong to which category? Like facial muscles. If I ask you this question, guys, give me your beautiful smile. You will say, sir, like this way. We will give the smile. And if I ask you this question, guys, give me the frowning, give me the your anger, show me your anger, then you will show you the anger. Yes, sir, they will kill you. Like this kind of anger you can show me. So like facial muscles, you can change your expression. Like tongue muscle. Tongue muscle is a voluntary muscle. Facial muscles are voluntary muscles, right? Right. So tongue muscle is also a voluntary muscle. You must be like I can see there are many females who are around us who have joined this lecture. So the most strongest muscle of female is the tongue muscle. Like they can kill anyone with their tongue muscle. That thing we know. So if I say our facial muscles and the tongue muscles are voluntary muscles, right? So can we call them skeletal muscles? So do we call them skeletal muscle? Answer is no. We call them a different name. We call them with a different name. So facial muscles, tongue muscles, right? We call them by which name? Answer is yes. Dr. Nimesh, Diksha and Akshita has answered this question. We call them somatic muscles. So we have a different set of muscles. We call them the somatic muscles. So somatic muscles are the muscles of our facial region. Somatic muscles are muscles of our facial region. These muscles are voluntary, but they are not skeletal muscles. The definition of skeletal muscle is like the any muscle that will participate in body movements, right? So any muscle that will help in body movements, that is known as skeletal muscle. But our facial muscles will not help us in body movements. So we call them a different name. We call them with a different name. We call them the somatic muscles. So guys, if I say what are the somatic nerves, the answer is somatic nerves are those nerves that will supply our voluntary muscles. So we have two types of voluntary muscles, skeletal muscle and somatic muscles. And autonomic nerves also supply two types of involuntary muscle. One is known as cardiac muscles, second is known as smooth muscles. So cardiac muscles, smooth muscles are type of involuntary muscles, right? So let's revise it again. CNS is the one that will control everything. That includes peripheral nerves. Peripheral nerves can be of two types, sensory or can be motor. Now we have two types of sensory nerves, somatosensory and autonomic sensory. And this system that will carry our sensation, this is collectively known as sensory nervous system. So this system is collectively known as sensory nervous system, right? Then we have the motor nervous system. In motor nervous system, we have further two systems. One is known as somatic nervous system. One is known as somatic nervous system. Somatic nervous system is the one that is connected with our voluntary muscle. We call it somatic nervous system. And we have a autonomic nervous system. Autonomic nervous system is the one that is connected with our involuntary muscles like the cardiac muscles and the somatic and the smooth muscles. Right, guys? Now, sensory nerves are those nerves that will carry our sensation. Right? So coming back to this sensory nerves are those nerves that will carry our sensation, and this sensation is transferred to brain. Right? So like whenever patient will have the toothache, right? So patient will have the toothache. So whenever the patient will have the toothache, the signal will go to brain, the patient is having the pain, right? So that signal is carried by the sensory nerves. So toothache ka pain sensation is carried by the sensory nerve, and that will go to our brain, and brain will process that pain, and accordingly we will have a motor action or we will have the reflex action. So if I ask for this question, whenever we have a stimulus, so-called pain present in our body, sensory nerves get activated. So how the sensory nerves will take the sensation from periphery to CNS? Any process you know from physiology by which the sensory nerves will take the sensation and transfer it to central nervous system. So the answer is sensory nerves have the presence of ions. So we have the presence of sodium ion and the potassium ion. So all the sensory nerves will work with the help of electrolytes or ions of the body. So we have ions in the body, we call them sodium ion and potassium ion. So whenever I give stimulus, like if you can see me, like this is my hand, if I give a stimulus like this way, so I have given a stimulus like this way, I can feel this pain, right? So it means my nerve get excited. And if my nerve is excited, which ion has taken entry? So sodium has taken entry that has started the stimulus and the potassium has come out. Right? So sodium will take entry, potassium comes out. This is how the sensory nerves carry the sensation. So if I say this is my brain, this is my sensory nerve, I have given a stimulus here. So sodium will take entry, this part get depolarized. This will depolarize the second part. So in this way, that potential will move from periphery towards the CNS and the sensation will be processed in brain. Right, guys? So this is how the sensory nervous system will act in the body with the help of sodium ion and the potassium ion. And technically, the sodium and potassium ions, so we call them electrolytes. So in medical field, instead of calling them ions, like ions, so we call them in the chemistry. So when in our school days, we used to call them ions, but in medical science, we call them electrolytes. So any idea, guys, which test we ask for the patient to undergo whenever we want to check the level of sodium and potassium? So if you are sitting in OPD, right, and you want to check, patient is complaining to you, ki sir, ki ma'am and sir, I'm having a lot of pain in my facial region, and patient has been referred to you because you are a dental surgeon. So patient is having a pain in the gums, and you have ruled out all the pathology of tooth, right? So you want to check that it may be because of some electrolyte imbalance. So any idea which test we ask for the patient to undergo so that you will come to know the level of sodium and potassium in the patient body? So let me tell you guys, yes, Jyoti Rana, this is action potentials, right? Yes, so the test is known as serum electrolytes. So the test that we ask for the patient to undergo is known as serum electrolytes. So whenever we write this test, when we tell the patient to get the serum electrolyte test done, it means we want to know what is the status of sodium, potassium, chloride, calcium, all the ions present in the body. So this is how we come to know about the level of ions in the body. This is with the help of serum electrolytes. Now we have a group of medicines that is blocker of our sensory nervous system, right? Yes, Dr. Navneet Krishna, electromyography, as the name suggests, myography, that is related to our muscles, right? So we cannot do the electromyogram because we don't want to check the muscle strength. So Navneet, like if I ask you this question, ki how we can check the muscle strength? I want to know ki whether my muscle is normal or abnormal. Then the answer would be electromyogram. But when I only want to check the ions, then the test is known as serum electrolytes, right? Yes, serum electrolytes mostly done with the KFT. So we also call it KFT with serum electrolytes. Good. So we have sodium and potassium ion, and we have a group of medicines which can block this sensory nervous system. So the medicines which can block this sensory nervous system, we call them local anesthetic drugs. So we have local anesthetic drugs. We call them local anesthetic drugs. So local anesthetics are the medicines which are blocker of the sensory nervous system. So these medicines, as the name suggests, anesthetics, they will lead to complete blockage of the sensation. These medicines can lead to complete blockage of the sensation. So if I ask you this question, whenever we give local anesthetics to a patient, patient will not feel the pain. So how these medicines will make it possible? How these medicines make it possible that patient will not feel the pain? So if I ask you this question, guys, what is a MOA? That is a mechanism of action of drug. So what is a mechanism of action of drug that we can do with that is there with the drugs so that the medicines can block all the sensation. So if I want to block all the sensation, right? So what would be the mechanism of action of medicine? So the drugs are known as local anesthetics. How these medicines will act in the body so that you will not feel any pain. Any guys, any idea, any suggestion? Like if you are a scientist and you want to develop a medicine which should immediately block the sensation of pain, you want to develop a medicine by which you want to block the pain sensation so that your patient should not feel any pain. So which medicine will you develop? Very good. Dr. Niharika has answered. We will develop a medicine that will block the action potential. Very good answer. Dr. Navneet has answered that we can give a medicine that is a channel blocker. So this is what I want to know. Which channel would you like to block? So the medicines are known as local anesthetics. So you people have to answer me, like what is the best thing to block over here so that I will not feel any pain? Yes, we can block the sodium channel. Very good. Dr. Navneet has answered. Yes, we can block the sodium channel. Even Aprajita has answered, we can block the sodium channel. So what is the mechanism of action of local anesthetic drug? Answer is local anesthetic drugs are blocker of sodium channel. Local anesthetic medicines are those drugs which can block the sodium channel, and if you increase the dose of this medicine, these medicines can also block the potassium channel. So local anesthetics will block the sodium channel. They also block the potassium channel. They block the sodium entry, like you people are now answering. So these medicines block the sodium entry, they block the potassium exit, and therefore these medicines are the one which can block the complete sensation. So I would like to know the examples of these medicines. So any example of the medicine that is a local anesthetic? So all medicines which are local anesthetics, they end with the word cane. So all these medicines that are local anesthetics, they end with the word cane. So any example of medicine you know, guys, that ends with the word cane? Any drug you know that is a local anesthetic? You people are dentist, and like you people would be using these medicines even more than our like MBBS doctors, right? So local anesthetics, they block the sodium channel. They also block the potassium channel. Yes. Yes. So one answer is like lidocaine. So one is lidocaine, articaine, lignocaine. Yes, all these are examples of medicines. So one example is like lignocaine, classical example. These medicines are known as local anesthetics. Prilocaine, yes. Other examples are like prilocaine, lidocaine. Got it, guys? Okay, one more question. These medicines are known as local anesthetics. So guys, why we call them local? Why we call them local? Are these medicines local brand? Are these medicines of local brand or branded? Are these medicines local or branded medicines? Anyone, any idea, guys? Are these medicines local or branded? Why we call them local anesthetics? Any guess? So we have a group of medicines. We have a second group of medicines that can block our somatic nervous system. We can have a group of medicines that can block our somatic nervous system. Yes, very good. So these medicines act locally. That's why we call them local anesthetics. So these medicines are branded, guys. Don't worry. Like it's not like that you have been cheated by the company people. So these medicines are branded, but we call them local because these medicines are given by local route. That's why we call them local anesthetics. Good, very good. Okay, so come to this somatic nervous system. So we have a somatic nerves. Somatic nerves are those nerves that will supply our voluntary muscles. Voluntary muscles are skeletal muscles and the somatic muscles, right? So if we talk about our somatic nervous system, in this somatic nervous system, we have a presence of a junction. This junction is known as neuromuscular junction. So in somatic nervous system, we have a presence of a junction. We call it a neuromuscular junction. So neuromuscular junction present in somatic nervous system. And here you people have to answer me from concepts of your physiology that in this neuromuscular junction, that is a somatic nervous system, there is a presence of a nerve that will release neurotransmitter. So the nerve will release a chemical, we call it neurotransmitter, and this neurotransmitter will act on a receptor which is present on the surface of muscle. So neuromuscular junction, as the name suggests, it's a junction between nerve and muscle. It's a junction between nerve and muscle. That's why we call it neuromuscular junction. So here the nerve will release a neurotransmitter and there is a receptor present on the muscle that will receive the neurotransmitter. So like if I am a receptor, I will receive the neurotransmitter and now my muscle, like I am present on my muscle. So my muscle will contract, right? So my question is, what is the name of a neurotransmitter that is released in neuromuscular junction of somatic system? And what is the name of the receptor present over here? Very good. So I can see many of you are answering correct. It's Dr. Saurabh Basu. Dr. Saurabh, you are sharing the name with me also. Like my name is also Saurabh, right? Yes. So Dr. Samira, Dr. Rudri, Aditi, Gautami, Akshita, all of you have answered correctly. Mahindra, Khushi, Ritz, Niharika. Yes, the neurotransmitter is acetylcholine. So in the neuromuscular junction, we have a neurotransmitter that is acetylcholine. So acetylcholine is released in the neuromuscular junction. Yes, guys. So you people have to answer me. What is the name of the receptor here? Yes, Dr. Gautami, Aprajita. These are our brilliant students. Yes, right. So these people have answered correctly. Like in this neuromuscular junction, we can take out the first two alphabet. So from this NMJ, we can take out the first two alphabets. So this is the name of the receptor. So this is the name of the receptor. Like the name of the receptor is NM. So NM is a nicotinic muscle type of receptor. So we call it nicotinic receptor. Now nicotinic receptor can be of two types, can be muscle type, can be neuron type. So we have a nicotine M, nicotine N, right? So we have a nicotine M receptor on which acetylcholine will act, and this is how our voluntary muscles will contract. So our voluntary muscles will contract, right? So our voluntary muscles will contract when this acetylcholine will act on NM receptor, and this is how the somatic nervous system will work. So guys, we have a group of medicines. We have a group of medicines which can block this somatic nervous system. Basically, these are the drugs which are blocker of this receptor. These are the drugs which are blocker of this receptor. So by blocking this receptor, NM receptor, these medicines will stop the muscle contraction. Rather, we can say that these medicines will make the muscles relaxed. So we have a group of medicines, we call them skeletal muscle relaxants. So we have a group of medicines, we call them skeletal muscle relaxants. So medicines are known as skeletal muscle relaxants. So skeletal muscle relaxants are the one which are blocker of our somatic nervous system. Skeletal muscle relaxants are the one which are blocker of our somatic nervous system. And these medicines mechanism of action. These medicines mechanism of action is they are blocker of NM receptor. So these medicines block this NM receptor, and once you block this NM receptor, acetylcholine cannot act on this receptor, and hence our skeletal muscles, voluntary muscles, somatic muscles get paralyzed. So we call them skeletal muscle relaxant, and all these medicines end with our curium or curonium. So all these medicines end with our curium or curonium. So medicines end with our curium or curonium. So who will answer me this question? Like any example you can give me? Any example of drug you can give me that ends with our curium or curonium? So I have told you that group is known as skeletal muscle relaxants. They are the blocker of NM receptor. The medicine's name end with the word curium and curonium. So you people have to answer me this question now. What are the examples? Like any drug you know that is example of skeletal muscle relaxant? Yes, the answer is etracurium. So one of the example is like etracurium, pancuronium. So we have pancuronium, etracurium, mevacurium. Yes, all these are medicines. Their mechanism of action is NM blocker. So all these medicines are blocker of this NM receptor. We call them skeletal muscle relaxants. Right. So guys, have you people ever used these medicines in your clinical practice? Like you people are dentists. So have you people ever used these medicines in your clinical practice? Have you people ever used these medicines in your clinical practice? Skeletal muscle relaxants. Okay, so this is question for you. Go and find out in which procedure you people have used these medicines in your dental practice. Okay. Now let's talk about the central nervous system. So we discussed so far, central nervous system is the one that contains brain and spinal cord. And this is a system that will control everything in the body. That will control everything in the body. So central nervous system. So we have a group of medicines that will block our central nervous system. We call them general anesthetic drugs. So we have the general anesthetic drugs. So general anesthetic drugs are those medicines which are blocker of our central nervous system. So general anesthetics are the medicines which are blocker of our central nervous system. And most of these medicines, which are GA drugs, general anesthetic drugs, they block the CNS by acting on GABA pathway. So most of these medicines will act on GABA pathway of CNS. They promote this GABA pathway of CNS. This is the mechanism of action. And by acting on the GABA pathway, these medicines can inhibit our central nervous system. So these medicines can inhibit our central nervous system. The medicines will act on GABA pathway. So here guys, you people have to answer me. GABA is a CNS pathway, right? So this is which type of pathway? Is it a stimulatory pathway or inhibitory pathway? So you people have to give me the answer that GABA pathway on which general anesthetics will act. Is it a stimulatory pathway or inhibitory pathway? Second question you have to answer me the example of this general anesthetic drugs. So one of the example of general anesthetic drug, yes, these medicines will act on GABA pathway. So GABA is which type of pathway? Is it a stimulatory or inhibitory pathway? Second answer, you have to give me the example of this medicine. So example of this medicine, which is a general anesthetic drug. So example of general anesthetic, yes, GABA is a inhibitory pathway. That's very good answer. So GABA is inhibitory pathway, and any example of medicine you know that's a general anesthetic. So the medicine which is general anesthetic that will act on this pathway, one of the example is like propofol. So one of the example is like propofol. This is a general anesthetic drug. So this medicine will act on GABA pathway. So we have most of the general anesthetics, they will act on GABA pathway. Example is like propofol. So these are the three group of medicines, general anesthetics that will act on GABA pathway. We have a sensory nervous system medicines blocker, local anesthetics. We have a skeletal muscle relaxants. And the fourth group of medicine is the one that is what we are going to discuss today. The medicines that will act on autonomic nervous system. So today we will discuss about the medicines that will act on autonomic nervous system. This is the topic that we are going to discuss today. Now, why we have discussed all these things? Because you should have basic knowledge. Okay, what are the various groups of medicines that can affect our nervous system? So we have total four group of medicines that will affect our nervous system. So we have general anesthetics that will block our CNS. We have a local anesthetics that will block our sensory system. We have a skeletal muscle relaxant that will block our somatic system, the motor component. And we have some drugs that we will discuss today that will block our autonomic nervous system. Now let's move on to the second type, details of autonomic nervous system. So we have discussed so far, autonomic system is the one that will supply our involuntary muscles. This is what we people have discussed already. Now, God has given us two type of autonomic nerves. God has given us two type of autonomic nerves. Yes, I can see most of you have answered correctly, like the examples of anesthetics you have answered, right? So let's talk about the autonomic nervous system. So we have two types of autonomic nerves which God has given us. So God has given us two type of autonomic nerves. The first is known as parasympathetic nerves. First type of nerves are known as parasympathetic nerves. The second type of nerves are known as sympathetic nerves. So we have parasympathetic nerves, we have sympathetic nerves, right? So we have two types of autonomic nerves. One is parasympathetic, one is sympathetic, right? So I hope you know the full form. So I am not, am I supposed to write the full form also for you, or you know the full form of parasympathetic and sympathetic? So we have two types of autonomic nerves. One is parasympathetic nerve, second is sympathetic nerve. So God has given us one type of somatic. Somatic is only one type, but autonomic nerves are of two types, parasympathetic and sympathetic, right? Now, although we have two types of autonomic nerves, but you people have to understand that at a given point of time, we required only one. So at a given point of time in our life, we required only one type of system. So when we required parasympathetic system, we don't require sympathetic. And when we require sympathetic system, we don't require parasympathetic. So although we have two types of autonomic system, one is parasympathetic, one is sympathetic, but at a given point of time, we required only one. So guys, let me tell you, whenever we people are in stressful event of our life, so whenever we people are in stress, we call it stressful stimulus present on our life. So whenever we have any stressful stimulus on our body, any stressful stimulus on our life, our sympathetic system is required. At that time, parasympathetic is switched off. And as long as we are not in stress, as long as we people are not in stress, our parasympathetic system remain activated all the time. So parasympathetic system is the one that remain activated all the time, because most of the time of the day we people are not in stress. I'm not talking about doctors. I'm not talking about the people who are preparing for entrance exam, right? So exception are those people, because these people always remain in stress. I'm talking about the general public which are around us, right? So general public most of the time remain non-stressful. So parasympathetic system activated all the time in their body, and whenever these people come in stress, their sympathetic system get activated to fight with the stress. So if I ask you a question, like if you eat food, like you are eating the food, you are absorbing the nutrients out of the food, you assimilate the food, you take out energy out of the food, you utilize that energy, you build up your proteins, you build up your muscles, you excrete, you urinate. So all these are the normal physiological process that is done by which system? So answer is all the normal physiological process of the body, like the food absorption, food assimilation, energy utilization, excretion, urination, all the process are done by parasympathetic system. But whenever we people come in stress, all these systems get switched off. So all the system gets switched off. So just imagine yourself, like whenever you are passing the urine, whenever you have to pass the urine. So whenever you have to pass the urine, passing a urine is a normal act of the body, right? So passing a urine required parasympathetic system. So assume you are passing a urine and suddenly someone entered in the washroom. And when someone entered in the washroom and asked you, "Arey, kya kar raha hai? What are you doing?" So the moment someone entered in the washroom and asked this question, "What are you doing?" immediately the urine gets stopped. This is a typical example of parasympathetic and sympathetic switching over. So when you were relaxed, you were passing the urine, right? So your parasympathetic system were activated. The moment someone entered in the room, so someone entered in the washroom, immediately you feel some stress and then the urine gets stopped. But suddenly you found that person in your roommate, and that person in your roommate and that person knows everything about you. So that's fine. Then again, the urine will again start coming out. So this is a typical switching of the parasympathetic to sympathetic. Then again come back to parasympathetic. So this much fast switching will take place in our body. This is what the God has given us, parasympathetic and sympathetic. Now in parasympathetic system, the neurotransmitter that is released is known as acetylcholine. So in parasympathetic system, the neurotransmitter is known as acetylcholine. That's why this system is also known as cholinergic system. So this system is also known as cholinergic system. So this is known as cholinergic system when acetylcholine is released. And now this acetylcholine will act on a receptor which is different from the NM receptor. So previously we discussed the NM receptor, that's a part of somatic system. So here the receptor name is muscarinic. So here the acetylcholine will act on muscarinic receptor. So just like somatic system, parasympathetic system is also a cholinergic system. Parasympathetic system is also a cholinergic system. It will release acetylcholine. Now this will act on a receptor, that's a muscarinic receptor, and can result in most of the normal actions of the body. If I ask you this question, guys, which neurotransmitter is released in sympathetic system? So which neurotransmitter is released in sympathetic system? You will answer here the neurotransmitter name is noradrenaline. So here the neurotransmitter name is NADR. The full form is noradrenaline. The other name of this noradrenaline is norepinephrine, right? So here the neurotransmitter is noradrenaline, also known as norepinephrine. So this system is also known as adrenergic system. So this system is also known as adrenergic system. So we have a cholinergic system, we have an adrenergic system. So in adrenergic system, we have the release of noradrenaline or the norepinephrine. Now this noradrenaline and norepinephrine will act on the receptors. The name of the receptors are alpha or beta. So here we have two receptors instead of one. So in parasympathetic system, we have only one receptor, muscarinic. That's why this system is easy to understand. Sympathetic system has two receptors. This is difficult to understand and this will give you stress. The sympathetic system gives you stress because you have to remember so many receptors, so many locations, but parasympathetic is easy system to remember, right? Now, just for the sake of completion of one MCQ, they will ask you, this parasympathetic system originates from which place of the body? So answer is parasympathetic system will originate from craniosacral part of the body. So parasympathetic system, also known as craniosacral outflow, right? So this will originate from the cranial part as well as from the sacral part. So parasympathetic nerves will come out in periphery from cranial part and sacral part. So we call them craniosacral outflow. And sympathetic nerves will come out from thoracolumbar part. So these nerves will come out from the thoracolumbar part. We call them thoracolumbar outflow. So these nerves are known as thoracolumbar outflow. So here you people have to answer me one question, like which cranial nerves are known as parasympathetic nerves? So this was the MCQ of your physiology. You people have to answer me. Yes, guys, Dr. Navneet, it's dorsolumbar. Dorsolumbar is thoracolumbar basically, right? So we call it thoracolumbar outflow. Now here you people have to answer me. What are the cranial nerves which are known as parasympathetic nerve? So like we have total 12 pairs of cranial nerves. We know that this point. We have total 12 pair of cranial nerves. So which cranial nerves are parasympathetic nerve? Like all nerves are not parasympathetic. Only 4 pair are parasympathetic. Only 4 pairs are parasympathetic. Yes, we call it 3, 7, 9, and 10. So we have cranial nerves number 3, 7, 9, and 10. So cranial nerves 3, 7, 9, and 10 are the one which are known as parasympathetic nerves. So we have the 3, 7, 9, 10 parasympathetic nerve. So here you people have to answer me one question. What is 2, 7, 9, 10? So this is 3, 7, 9, 10. These are the cranial nerves which are known as parasympathetic nerve. That's fine. But I want to know, like you people must have covered the biochemistry. So use the knowledge of your biochemistry and please tell me what is 2, 7, 9, and 10. Very good. So Dr. Jayant Joshi has given the names of the nerves also, oculomotor, facial, glossopharyngeal, and the vagus nerve. Also, guys, Dr. Jayant Joshi try to answer like 3, 7, 9, 10 are the numbers of nerves which are known as parasympathetic nerve. But try to recall, try to recollect, try to activate your brain and find out the answer. What was 2, 7, 9, 10? Very good. So 2, 7, 9, 10 were vitamin K dependent clotting factor. So they are the vitamin K dependent clotting factor. Wonderful answer, Dr. Prajita. So 2, 7, 9, 10 are the 4 clotting factors which are dependent on vitamin K to get activated. Although there is no relation between two, but you can confuse with the numbers. Why I'm telling you, you can confuse with the numbers. So the nerves are 3, 7, 9, and 10. This is what you people have to remember. Okay. Now, this is all about the basics of autonomic nervous system. Two types of autonomic nerves we people have covered. Stress may we have sympathetic, non-stress may we have parasympathetic. In parasympathetic system, neurotransmitter acetylcholine, receptor is muscarinic. Now, starting with the first system, guys. The first system is known as cholinergic system. The first system I am starting is known as cholinergic system. So, if I ask you this question, which nerves are cholinergic nerves in human body? So the first point is which type of nerves are known as cholinergic nerves? What are the types of nerves are known as cholinergic nerve? Then the answer would be all parasympathetic nerves. So all parasympathetic nerves are cholinergic nerves. This is true. So all parasympathetic nerves are cholinergic nerves. Statement is true, right? Second is all somatic nerves. All somatic nerves means the nerves that will supply our voluntary muscles. Nerves that will supply our voluntary muscles. Even those are also cholinergic. So parasympathetic nerves are cholinergic and all somatic nerves are also cholinergic, right? So you people have to answer me what are the names of the receptors present in relation to these nerves. Anyone can answer, guys? All parasympathetic nerves are cholinergic. All somatic nerves are cholinergic. You people have to answer me what is the name of the receptor which is present in relation to these two nerves. So although we people have already covered, but still you have to answer me all parasympathetic nerve receptor is what? All somatic nerves receptor is what? Yes, the answer should be all parasympathetic nerves release acetylcholine. They will act on muscarinic receptor, and all somatic nerves release acetylcholine, and the receptor is nicotine muscle type. So you have to answer it properly, like guys, because now we are moving on to the stage 2 of our learning. Stage 1 we people have covered, that's the nicotine receptor. Now you have to answer me which type of nicotinic, that is NM. So nicotine M type of receptor is the one that is involved over here. So these are the two nerves that you should be knowing, which are known as cholinergic nerves. Number two, you people have to answer me. We'll discuss now how the acetylcholine synthesis will take place. How the acetylcholine synthesis will take place in these nerves. So the above two nerves are cholinergic nerves. We will discuss how the acetylcholine synthesis will take place in these nerves and how the acetylcholine is released. So it's very simple, guys. Acetyl is a chemical present in the body. Acetyl is a chemical present in the body in the form of acetyl CoA. So acetyl is a chemical present in the body in the form of CoA. This is a part of Krebs cycle. Krebs cycle. What is Krebs cycle, guys? Where does the Krebs cycle take place in the body? What is Krebs cycle and where does the Krebs cycle take place in the body? So acetyl CoA is a part of Krebs cycle. This will come from the Krebs cycle and acetyl CoA binds with choline. So very simple, guys. How the acetylcholine synthesis will take place? The answer is acetyl binds with choline. This will form acetylcholine. Nothing can be easier than this. Acetyl binds with choline. This will form acetylcholine. Yes. So we have a Krebs cycle. Where does the Krebs cycle take place? The answer is mitochondria. Very good answer. So Krebs cycle will take place in mitochondria. So from the mitochondria of a neuron, acetyl CoA comes out and choline will come from the plasma and they will bind to each other and they will form acetylcholine. Now this acetylcholine which is formed, this is stored in a vesicle. So this acetylcholine which is formed over here is stored in a vesicle. So guys, what is vesicle? Vesicle is a storage granule. Vesicle is a storage granule that is present at the end of the nerve. So at the ending of the nerves, we have a present of a storage granule. We call it vesicle. So vesicle is a structure in which neurotransmitter is stored. So how the acetylcholine synthesis will take place? You have to just remember acetyl binds with choline. This will form acetylcholine. Acetylcholine gets stored in the vesicle and whenever body requires, this acetylcholine is released and this acetylcholine will act on its receptor and perform the action. So acetylcholine synthesis and its release we are discussing. So here the most important point is how the acetylcholine is released. So how the acetylcholine is released, this is most important point to understand. So the signal will come from the brain. So I'm talking about our peripheral nerves like the parasympathetic nerve or the somatic nerves. So parasympathetic nerves, somatic nerves in periphery, they will release acetylcholine. So the signal will come from the brain. So positive sign means the signal is coming from the brain. So this is the signal that is coming from the brain. This is coming down from the brain. So the signal will reach the periphery of the nerve. There is opening up of one channel that will take place. So one special channel will open up and with the help of the special channel that will open up, there is one ion that will take entry. The name of the ion is calcium ion. So calcium will take entry when this potential from the brain reaches the periphery of the neuron. So when this potential will reach the periphery of a neuron, the calcium will take entry inside this neuron. So calcium will take entry inside this neuron, and when this calcium will take entry inside the neuron, this calcium will go and attaches with the membrane of the vesicle. So this will go and get attached with the membrane of this vesicle, right? So calcium ion will take entry. This will go and get attached with the vesicle membrane. Now guys, on the surface of vesicle membrane, we have a presence of protein. So there is a protein on which the calcium will come and bind. The name of the protein is synaptobravin protein. So name of the protein is synaptobravin protein. So we have a protein present on the vesicle membrane. We call it a synaptobravin protein. So calcium will come, bind to this protein and activate this synaptobravin protein. Calcium will activate this synaptobravin protein. Now, when this calcium plus synaptobravin has been activated, now this combination get attracted. This combination get attracted towards one more protein present on the nerve membrane, and this protein is known as syntoxin protein. So this is present on syntoxin protein. Present on nerve membrane, we call it syntoxin protein. So let me tell you guys one thing. We have presence of some proteins in the neuron. We call them fusion proteins. So the nerve proteins are known as fusion proteins. They will help in the fusion of membrane. So as the name suggests, fusion protein, they will help in the fusion of the membrane. Now these fusion proteins collectively known as snare proteins. So collectively these proteins are known as snare proteins. In physiology we call them snare proteins. Now these snare proteins can be of two types. These snare proteins can be of two types. If the proteins are present on vesicle, we call them synaptobravin. So we call them synaptobravin. If they are present on the nerve membrane, we call them syntoxin. So we have a syntoxin protein on the nerve membrane and we have a synaptobravin protein on the vesicle. We call them collectively the fusion protein. Now guys, one of the syntoxin protein that is present over here is known as SNAP25. So one of the syntoxin protein that is present over here is known as SNAP25. So SNAP25 is the name of a syntoxin protein present on the nerve membrane on which this calcium plus synaptobravin will come and fuse. So calcium will activate synaptobravin. This will get attracted towards SNAP25 and this will lead to fusion of this membrane. And when there is a fusion of this membrane, acetylcholine is released. So I have discussed with you the detailed mechanism how the acetylcholine is released actually in the nerve, right? So stimulus has come from the brain. Calcium has taken entry. Calcium has activated synaptobravin. Synaptobravin attracted towards syntoxin. That's a SNAP25 protein. And this is how the acetylcholine is released. Now we have a drug, guys, with us. The medicine that is inhibitor of this SNAP25. So I have a medicine with me that will go and occupy this syntoxin protein. So I have a drug with me that will go and occupy this syntoxin protein. And if this medicine will occupy this syntoxin protein, now this calcium cannot bind with this syntoxin. And when this calcium cannot bind with this syntoxin, acetylcholine release is blocked. So acetylcholine release is blocked when this SNAP25 protein is blocked by a medicine. So we have a drug that will go and block this syntoxin protein, block the SNAP25 protein. The brand name of this medicine is Botox. So we have a drug, we call it Botox. So Botox is a medicine which is inhibitor of SNAP25 protein, right? So Botox is actually known as botulinum toxin. So this is known as botulinum toxin. So Botox is a brand name of botulinum toxin. Now use the knowledge of your microbiology. You people have to tell me this Botox or botulinum toxin, from which bacteria we get this toxin. So this medicine we have obtained from a bacteria. So who will tell me the name of a bacteria from which we have obtained this toxin, that is botulinum toxin? So I'll give you one hint. The name of the botulinum toxin has the name of a bacteria. Yes, the name of the bacteria is there in the name of a medicine name. So medicine के name में इसका origin है, right? The name of a bacteria is Clostridium. So we have obtained this medicine from Clostridium botulinum bacteria. So we have obtained this medicine from Clostridium botulinum bacteria. This is the origin of this medicine. Now Clostridium bacteria can produce many toxin. The toxin that we use clinically is known as type A toxin. So Clostridium toxin we use clinically, and the toxin that we use clinically is known as type A toxin. Like bacteria can produce 7 toxin, but all 7 toxins we cannot use as a drug, but only type A toxin we can use as a drug. Right? Now you people have to tell me the mechanism of action, how this Botox will act in the body. So the answer is Botox is a drug. The mechanism of action of medicine is this medicine is irreversible inhibitor. This is the medicine which is a irreversible inhibitor. This is an irreversible inhibitor of SNAP25 protein. This is a irreversible inhibitor of SNAP25 protein. And by blocking this SNAP25 protein, this medicine can inhibit. This medicine can inhibit. The cross means inhibit, right? So irreversible inhibitor of SNAP25. This will inhibit the release of acetylcholine. This will inhibit the calcium mediated acetylcholine release. This is the one that will block the calcium mediated acetylcholine release. And when it will block this release of calcium, when it will block the release of acetylcholine, then the muscles will get relaxed. So acetylcholine is not released, the muscle will not contract, the muscle get relaxed. This is the mechanism of action of Botox, right? So this is the mechanism of action of Botox, and because the Botox is irreversible inhibitor, because the Botox is a reversible inhibitor, this medicine action lasts for long term. So medicine action is long action. So medicine action is long action that can last for 2 to 3 months. So this medicine Botox action lasts for 2 to 3 months. So this is an irreversible inhibitor of this uh, SNAP25 protein. Now guys, any indication like in your dentistry, nowadays many dentists are involved in cosmeticology, right? You must be knowing people who are dentists, they are involved in facial cosmetology, facial aesthetics. So this medicine has a role in aesthetics, right? Aesthetic medicine, this medicine has a role. So any idea what is the role of this medicines in aesthetic clinics? Aesthetic clinics में where do we use Botox? For what purpose we use Botox? So Botox को why do we use nowadays in aesthetic industry? So the answer is this is given for the treatment of wrinkles. So this is given for the treatment of wrinkles. So this is given as an anti-aging. So given for the treatment of wrinkles, given as an anti-aging medicine, the drug is Botox. So if you can see me guys, do I look like 55? So there was a time when I got this kind of wrinkles on my forehead. Like you can see these wrinkles. So I got this kind of wrinkles. So what I did, I took this Botox, my muscle get relaxed. So now I look young, right? So I look young because I took this Botox. So this is how the people can look young like me. So treatment of wrinkles for the people, anti-aging treatment, we can give the Botox to a patient, right? So this is how the acetylcholine synthesis and its release can take place. The drug name is Botox, which is important for the exam we have discussed over here. Now, after this acetylcholine synthesis and its release, we can discuss the third point, how the acetylcholine get metabolized in the body. So how the acetylcholine is metabolized in the body. So if we talk about the acetylcholine metabolism in the body, so acetylcholine is metabolized by the enzyme. We call it acetylcholine esterase enzyme. So this is metabolized by one enzyme. The name of the enzyme is acetylcholine esterase enzyme. So we have a acetylcholine esterase enzyme. This is the enzyme that is involved in metabolism of acetylcholine, right? Now, acetylcholine esterase is involved in acetylcholine metabolism. Now, just like acetylcholine esterase enzyme, we have a similar enzyme. We have a similar enzyme present in our plasma, similar to acetylcholinesterase. We have an enzyme present in plasma. We call it plasma choline esterase. We call it plasma choline esterase. We also call it pseudocholine esterase. We also call it pseudocholine esterase or plasma choline esterase. Right? So here you people have to understand pseudocholinesterase, plasmacholinesterase is an enzyme present in plasma, and acetylcholinesterase is an enzyme. This is present in synaptic cleft. This is present in that synapse where the acetylcholine is released. So where the acetylcholine is released, there we have this enzyme, acetylcholinesterase. But in plasma, we have the presence of plasma cholinesterase enzyme, right? right? So, guys, you people have to answer me one question. Uh, like, if you people are taking a drug that contains ester bond, assume you people are taking a drug that contains ester bond. So one thing is sure, that medicine is going to get metabolized by esterase enzyme in your body. So that medicine will be metabolized by esterase enzyme in your body. So my question is, that medicine get metabolized by which enzyme? Acetylcholinesterase or pseudocholinesterase? Right? Can any one of you answer me this question? So whenever you take any medicine that contains ester bond, that medicine will be metabolized by which enzyme? Acetylcholinesterase or pseudocholinesterase? That's the plasmacholinesterase. So the answer is all ester containing drugs, all medicines which contain ester. So all medicines which contain ester bond, these medicines are metabolized by this pseudocholinesterase or the plasmacholinesterase. So this is more important enzyme for us than the acetylcholinesterase that is present in synaptic cleft and not available for any action. So let me discuss some examples with you. Like we have a drug mivacurium. So if I say mivacurium is a shortest acting, mivacurium is the shortest acting skeletal muscle relaxant. It's the shortest acting non-depolarizing. I should make it a correction here. So this is the shortest acting non-depolarizing muscle relaxant. It's the shortest acting curium. Mivacurium is the shortest acting curium. And why this drug is shortest acting? Because this is metabolized by pseudocholinesterase enzyme. Similarly, we have a opioid. We have a opioid. The drug name is remifentanil. So this is an opioid. This is the shortest acting opioid in the body. This is the shortest acting opioid in the body. We call it remifentanil. So remifentanil is the shortest acting opioid. Mivacurium is the shortest acting muscle relaxant. And we have a drug ismolol. We have a ismolol is the shortest acting. It's the shortest acting beta blocker. You can see all groups, whatever is the shortest acting medicine, that is metabolized by the pseudocholinesterase enzyme. If you can see the name of ismolol, ismolol is the name of a beta blocker. This starts with the word es. So this starts with the word ismolol. Sorry, this starts with the word ester. So this medicine contains ester bond. So this medicine contains ester bond in its structure. It's the shortest acting beta blocker, right? Remifentanil is the shortest acting opioid. Mivacurium is the shortest acting non-depolarizing muscle relaxant. And all these medicines are metabolized by this enzyme, pseudocholinesterase enzyme, that is present in our plasma. Acetylcholinesterase is only and only for acetylcholine. This is only for natural acetylcholine. You have to understand this thing. For our clinics as a doctor, the pseudocholinesterase is more important for us than the acetylcholinesterase because most of the drugs will act on this enzyme. Now, after this metabolism of acetylcholine, we can discuss the fourth point. The fourth point is acetylcholine receptors. So if we talk about acetylcholine receptors in the body, if we talk about receptors of acetylcholine in the body, so I will say acetylcholine can act on two types of receptors. Acetylcholine can act on two types of receptor. This can act on nicotine receptor. This can act on muscarinic receptor. Acetylcholine can act on two types of receptor, nicotine receptor and the muscarinic receptor. So if I ask you this question, guys, where we have the nicotine receptor, how many types of nicotine receptor we have? So answer is there are two types of nicotine receptor we have. So if the nicotine receptor is present over neuron, we call it nicotine N. If the nicotine receptor present over muscle, we call it nicotine M. So if the nicotine receptor present over neuron, we call it nicotine N. If it is present over muscle, we call it nicotine M. Now, muscarinic receptor is of five types of receptor. Muscarinic receptor is of five types of receptor. Now, guys, please remember, all these receptors are all receptors of acetylcholine are stimulatory. So all receptors are stimulatory. The signal going above, the arrow going above means arrow going up means it is stimulatory. So all receptors are stimulatory except muscarinic 2 and muscarinic 4. So muscarinic 2, muscarinic 4 are inhibitory receptor. Rest of the receptors are stimulatory. So all acetylcholine receptors are stimulatory. All nicotinic, all muscarinic are stimulatory, except muscarinic 2 and 4, which are inhibitory type of receptor. Now you people have to answer me, where do we have the nicotine M receptor present? Where do we have nicotine N? Where do we have nicotine M? So nicotine M we people have already covered. Nicotine M we people have already covered. Where do we have the nicotine M receptor present in the body? So answer is, it is present in somatic nervous system. So this is the receptor that is present in our somatic nervous system. Somatic nervous system means, guys, which muscles? Voluntary or involuntary? So the answer is, this is the receptor which is present over all voluntary muscles of the body. So this is the receptor which is present over all voluntary muscles of the body. We call it a nicotine M receptor. So nicotine M receptor present on the surface of all voluntary muscles. This is what we people have already covered. Right? Now, there is a property of this receptor. The property of this receptor is, whenever you overstimulate this receptor, whenever you overstimulate this receptor. So whenever we have a overstimulation of this receptor, like when we overstimulate this receptor, the property of the receptor is, this receptor temporarily, so this receptor is temporarily down regulated. So receptor will get desensitized. So there is a down regulation of receptor. So temporarily the receptor get desensitized. So receptor get desensitized temporarily when you overstimulate this receptor. So whenever you overstimulate this receptor will stop working for a time being. Then again after some time, when you stop the action, when you stop stimulating it, it will again get activated. So the receptor again get activated after some time. But initially when you overstimulate, the receptor get down regulated. Now guys, this is what we do by using a medicine. The medicine name is succinylcholine. So we have a drug succinylcholine with us. Succinylcholine is a medicine. As the name suggests, successive. This is successive choline. This is successive choline, succinylcholine. So this is the medicine that contains two molecules of acetylcholine. This contains two acetylcholine together in one molecule. So one molecule of drug contains two acetylcholine. So whenever we give succinylcholine to a patient, this is the one that is going to stimulate NM receptor excessively. And when this will stimulate nicotine M receptor excessively, the receptor get down regulated. And when the receptor get down regulated, this is used as a muscle relaxant. This medicine is used as a muscle relaxant, and this type of muscle relaxation is known as depolarized muscle relaxant. So succinylcholine is a different from curium. Like we discussed already, guys, curiums are the medicines which are blocker of this receptor. So we discussed already, curiums are the medicines which are blocker of this receptor. So whenever we give medicines like curiums, etracurium, pancuronium, vicuronium, these medicines are blocker of NM receptor. So these medicines block this NM receptor. So we call them non-depolarizing muscle relaxant. We call them non-depolarizing muscle relaxant. But succinylcholine will overstimulate this receptor. And because it will overstimulate this receptor, this is the one that will cause depolarization followed by the muscle relaxation. So this is known as depolarizing muscle relaxant, and the curiums are known as non-depolarizing muscle relaxants. Now we have a nicotine N receptor. Now where do we have the nicotine N receptor? So nicotine N receptor is present wherever we have the nerve and nerve junction present in the body. So we have a double N, guys. Double N means nerve-nerve junction. So wherever we have the presence of nerve-nerve junction. So wherever we have the presence of nerve-nerve or neuron-neuron junction, there we have this receptor present. And the maximum number of times you will find this receptor in central nervous system. So maximum of this receptor present in central nervous system, because in central nervous system we have the maximum presence of nerve-nerve junction. So maximum presence of nicotine N receptor is in central nervous system, and this is the receptor which is involved in nicotine addiction. So this is the receptor that is involved in nicotine addiction. So guys, you must have heard of this nicotine addiction. right? Even people come to you with nicotine addiction, they take tobacco. So tobacco, you understand ना guys? Tobacco, like Vimal, they consume Vimal. Vimal में केसर का दम है, केसर का दम वाला Vimal, right? So they consume this Vimal, they consume this Raj Darbar, they consume this Manik Chand. So they consume Manik Chand, Raj Darbar, Vimal. So they will come to you and they get addicted to this nicotine. So which receptor they stimulate in their brain? Answer is nicotine N receptor. So nicotine N receptor they stimulate in their brain. Guys, how many of you chew tobacco? I know dentists never chew tobacco. You know? Dentists never chew tobacco, but dentists smoke cigarettes, right? Diksha, NDMR means non-depolarizing. Like these medicines will cause muscle relaxation without stimulating the receptor. So without any depolarization, these medicines relax the receptor, relax the muscle. So we call them non-depolarizing muscle relaxant. Succinylcholine is known as depolarizing muscle relaxant. So guys, you people have to remember the name of a nicotine N receptor that is involved in nicotine addiction. So what is the name of the receptor involved in nicotine addiction? The name of the receptor you people have to remember is alpha 4 beta 2 type. So people consume tobacco like this way, they just press, I don't know what they do with this, and then they keep it here like this here. Feature, then they speak like this way. So we have a nicotine receptor. So a nicotine receptor in the brain which is alpha 4 beta 2 type. So we have a alpha 4 beta 2 type of receptor which is involved in nicotine addiction. Right? Nicotine N, this is important name, alpha 4 beta 2 type that is involved in nicotine addiction. Now this is the receptor that is also involved in our memory center. So this is also the one that is involved in our memory center. So whenever you take tobacco or if you take cigarettes, people have seen, like this has been seen, that you will never suffer from memory loss. So people who take tobacco, people who smoke cigarettes, they never suffer from dementia. They never suffer from Alzheimer disease because they keep on stimulating this receptor, and thus the same receptor is involved in memory center. So if you really want to improve your memory, then you can consume nicotine and cigarettes for a time being. Like you people are preparing for the entrance exam, right? So after 5 months or 6 months, you have the entrance exam. So you can give a try. You can start taking this medicine, and after 6 months, whenever you want, you can stop it if it is possible to stop then, right? So memory center is stimulated by this receptor. Next is we have a muscarinic receptor. Where do we have the muscarinic receptor present? So we have a muscarinic 1 receptor. So muscarinic 1 receptor present in GAT, and this is involved in acid secretion. So this is the one that is involved in acid secretion, that is a GAT. So muscarinic 1 receptor, yes, this is true. Like when you consume cigarettes, you never suffer from dementia. This is true, written in Harrison. Harrison is a book of medicine. It's written there, right? You can go and check right now, even if in case you want. So GIT mein we have muscarinic 1 receptor that is involved in acid secretion. Now this is the one that is also present in CNS, and the stimulation of this receptor result in tremors. Stimulation of this receptor result in tremors, and in GIT this is involved in acid secretion. Now we have the muscarinic 2 receptor. Now muscarinic 2 receptor, it is present on the heart. It is present on the heart. Now here you people have to answer me. Whenever I stimulate muscarinic 2, whenever we stimulate muscarinic 2, what happens to the heart rate? The heart rate will increase or decrease. So you people have to answer me this question. Whenever I stimulate muscarinic 2, the heart rate will increase or decrease. Let's talk about muscarinic 3 receptor. Muscarinic 3 receptor is present on the surface of all smooth muscles. This is present on the surface of all smooth muscles and all glands of the body. And here you people have to answer me. Yes, guys, निकोगम्स जितने भी निकोटिन एडिक्शन को ट्रीट करने के ड्रग्स हैं, like I will teach you the drugs that is given for nicotine addiction. They will act on this receptor. Why we are remembering the receptors? Because we have to treat the patients. So this is how we can treat the patient, because we will give some drugs that will act on this receptor. Nicotex. Yes, Nicotex is one brand name of nicotine that is given for nicotine addiction, de-addiction. That's good. Yes. Yes, you people have answered correctly. They will decrease the heart rate. So how do you know that the heart rate is going to decrease? Because you know that muscarinic 2 is inhibitory type of receptor. So muscarinic 2 is an inhibitory type of receptor, so the heart rate is going to decrease. Similarly, you know muscarinic 3 is a stimulatory receptor. Muscarinic 3 is a stimulatory receptor, so all smooth muscles will be contracted. So all smooth muscles will be contracted. So this will result in contraction of smooth muscles, and this will also result in increased secretion of all glands. So all glandular secretions are increased, muscles will be contracted, and the locations of muscarinic 4 and 5. Locations of muscarinic 4 and 5 are not important for the exam. We can leave these receptors as such. So we have total 5 receptors. Muscarinic 1 present on GIT and CNS. In GIT involved in acid secretion. In CNS it is involved in tremors. Muscarinic 2 present over heart, decrease the heart rate. Muscarinic 3 present everywhere, including smooth muscles and glands. 4 and 5 are not important to know for the exam. This is all about the locations of the receptors. Now after the locations of the receptors, we can discuss the acetylcholine actions. So what are the actions of acetylcholine that will take place on the body? So what are the various actions of acetylcholine that will take place in the patient body, right? So let me have some water, right? So we have a acetylcholine. This acetylcholine can act on 3 types of receptor. This can act on nicotine M receptor. This is act on nicotine M receptor, and this will also act on muscarinic receptor. So discussed already, by acting on nicotine N receptor, this will stimulate the CNS. So this is the one that is involved in maintenance of memory and learning. This is involved in maintenance of learning and memory. This is also involved in maintenance of our cognition. So guys, what is cognition? Cognition is like general awareness, like how to behave in society, how to live a normal life. This is cognition. Like if I ask you this question, right now you people are listening this lecture, right? You people are listening this lecture. Some of you may be standing, some of you may be sitting, right? So the people who are sitting, you may be sitting on bed, you may be sitting on sofa. So why don't you listen this lecture? Why don't you watch this lecture by standing on the table, by standing on that sofa? Why you people are sitting on the sofa? Why you people are sitting on the bed and watching this lecture, listening the lecture? Why don't you people stand on the sofa? Why don't you people stand on your central table and then watch this video? Why you people are doing like this way? One more question. I have a one curious question in my mind. When you people are watching this lecture, you people are looking at the screen of the mobile. Why don't you look behind and watch this lecture? Why don't you look behind and watch this lecture? Because it's your cognition. This is the cognition. Like you know that the sofa are meant to be sit upon, right? On bed we should sit upon, right? We should not stand on the bed, we should not stand on the central table, and whenever we have to watch the lecture we have to look at the screen, not behind. So this is your cognition, this is maintained by acetylcholine. So acetylcholine is the one that maintain your cognition, that maintain your memory. This is the function of acetylcholine in your body, in CNS. Now we have a nicotine N receptor. This is what we have already covered. This is involved in muscle contraction. So voluntary muscles will be contracted. This is what we have covered. Now, when this acetylcholine will act on muscarinic receptor, when this muscarinic acetylcholine will act on muscarinic receptor, what is the action? Actions ko you people can remember with the mnemonic. The mnemonic is dumbbells, right? So mnemonic ko you can remember with the word dumbbells. So in this dumbbells, please remember guys, acetylcholine will act on muscarinic receptor. D stands for diarrhea. So acetylcholine can result in diarrhea. So diarrhea means increased peristalsis. So with the help of muscarinic receptor, acetylcholine can result in increased peristalsis. Acetylcholine can result in dilatation of blood vessels. So blood vessels will be dilated. So dilatation of the blood vessels. So D stands for diarrhea. D stands for dilatation of the blood vessels. So blood vessels will be dilated, so the blood pressure will fall. So blood pressure will fall. Here the U stands for urination. So this acetylcholine help the patient to pass urine. Number 4, B stands for bronchospasm. B stands for bronchospasm. Now B also stands for bradycardia. So B also stands for bradycardia, right? So what does this dumbbell stands for? That is through muscarinic receptor. D stands for diarrhea. D stands for dilatation of blood vessels, right? U stands for urination. Sorry, I've forgotten the M in between. So if you talk about this M, I don't know how I have forgotten the M. So if we talk about this M in between, so M stands for meiosis. M stands for meiosis. So M stands for meiosis. Now who will tell me what is meiosis? Who will tell me what is meiosis? This is something related to eyes. So it is something related to the size of pupil. So size of pupil will be small or size of pupil will be large. So meiosis means what? This is constriction of pupil or dilatation of pupil. Constriction of pupil or dilatation of pupil. Anyone can answer? The pupil will become big, the pupil will become small. Yes, so pupil will become small. This is meiosis. The opposite of meiosis is mydriasis. Opposite of meiosis is mydriasis. Right, guys? So people remember like this way. The meiosis has less number of spellings, less number of alphabets, small word, small spelling, small pupil. Mydriasis, big word, more number of alphabets, big spelling, big pupil. So mydriasis may pupil become big and meiosis may pupil become small. So acetylcholine will make the pupil meiotic. Yes, very small pupil. Bronchospasm, bradycardia that will occur. Now this will also result in erection. This will also result in erection. So in males, this phenomena is physiological phenomena, erection. So for the sexual arousal, whenever the males will have sexual arousal, they will have erection. So erection is again when the males are relaxed. So this is the action of parasympathetic system, right? So guys, please remember, whenever males are relaxed, their parasympathetic system is active, then only erections are possible, then only they can have the sexual arousal. Whenever the males are in stress, whenever the males are in stress, then these erections are not possible, right? So during stress, sympathetic system is activated and that will cause loss of erection. So guys, there is a disorder in males, we call it erectile dysfunction. So disorder of male is known as erectile dysfunction. So who will tell me what is the most common cause? What is the most common cause of erectile dysfunction in males? Anyone can answer? Anyone, if you people read the psychological part in your pedodontics. So do you have any idea? What is the most common cause of erectile dysfunction in males? The answer is stress. The stress or anxiety that will lead to activation of the sympathetic system and the switching off of parasympathetic system is the main reason for the most common cause of the erectile dysfunction in males, right? So whenever we have to treat erectile dysfunction, we have to give medicines that will promote the parasympathetic system. Next is we have this mnemonic dumbbells up till E we people have discussed. Then we have LSS. So here the L stands for lacrimation. Here the L stands for lacrimation, S stands for salivation, and S also stands for sweating. So L is for lacrimation, salivation, and sweating. So lacrimation and salivation and sweating, all this is due to the stimulation of the glandular secretion. So all the glandular secretions are increased. So we have lacrimation, salivation, and sweating. And the last S stands for increased secretion. Increased secretion of acid in GIT. So increased secretion of acid in GIT, that is also through muscarinic receptor. So that is already covered, that muscarinic 1 is the receptor that is present in secretion of acid. But lacrimation, salivation and sweating, this is due to muscarinic 3 receptor. So guys, being as a dentist, if any patient comes to you with dry mouth, if any patient comes to you with dry mouth, you are supposed to stimulate the muscarinic receptor. So if you stimulate the muscarinic receptor, patient dry mouth will be taken care of. So this is all about the full form of mnemonic dumbbells. So acetylcholine can result in actions through nicotine N receptor, nicotine M receptor, and the muscarinic receptor. Through this muscarinic receptor, this will cause dumbbells. Through nicotine M receptor, this will cause muscle contraction. Through nicotine N receptor, this will cause CNS stimulation. Based on this physiology, so we people have covered the physiology. Now we are moving on to the drugs. Drugs that will act on parasympathetic system. So just a quick revision, guys, that the things that we have discussed so far. So if we talk about this quick revision, we have discussed so far that we have a cholinergic system. All parasympathetic nerve, all somatic nerves are cholinergic nerve. They release acetylcholine. Receptors are muscarinic for parasympathetic. This is NM for somatic. Acetylcholine synthesis will take place when acetyl binds with choline, stored in a vesicle. Whenever required, it is released with the help of fusion proteins. So Botox is a drug inhibitor of the SNAP25 protein, inhibit this release of acetylcholine, and this is an irreversible inhibitor of this SNAP25. So the action lasts for 2 to 3 months. Acetylcholine mainly metabolized by acetylcholine esterase enzyme, but corresponding to this enzyme, we have one more enzyme, plasma cholinesterase, pseudocholinesterase, that is involved in metabolism of the drugs that we give from outside. So all the medicines that we give from outside, those medicines will go and those medicines will enter in our plasma, and in plasma, these medicines get metabolized by this enzyme, that is mivacurium, remifentanil, and esmolol. Then we have acetylcholine receptor, nicotine muscarinic. We have discussed their location, and then we discussed its action finally. Now, based on this knowledge, guys, we can start with the drugs. So there are two types of medicines that will act on this parasympathetic system, right? Yes. So there are two types of medicines that we can use that will act on parasympathetic system. One is known as cholinergic drugs. The first type of medicines are known as cholinergic drugs. The second type of medicines are known as anticholinergic drugs. So we have cholinergic drugs, we have anticholinergic drugs. Now, cholinergic drugs are those medicines which will result in dumbbells as the effect in the body. So we people have already covered the parasympathetic system with the help of muscarinic receptor can result in dumbbells. So cholinergic drugs are those that will result in dumbbells as the effect in the body, and anticholinergic drugs are those medicines that will do opposite to dumbbells. So these are the medicines that will do opposite to dumbbells, right? So we have medicines that will cause dumbbells, and we have medicines which will do opposite to dumbbells, right, guys? Now the medicines, we're starting with the first group of medicines, medicines which are cholinergic drugs, medicines that will cause dumbbells. Now the medicines that will cause dumbbells as the effect in the body, these medicines are further subclassified in two groups. So these medicines further of two types. These medicines can be directly acting. These medicines can be directly acting drugs, and these medicines can be indirectly acting drugs. So these medicines can be directly acting medicines, can be indirectly acting medicines. So we have the cholinergic drugs. Cholinergic drugs can be directly acting, can be indirectly acting. Now the medicines which are directly acting, these medicines are the one which will directly stimulate muscarinic receptor. So these medicines are given to stimulate muscarinic receptor directly. So directly acting medicines are those which are given to stimulate muscarinic receptor directly. What are indirectly acting drugs? Indirectly acting drugs are those medicines which are inhibitor of acetylcholine esterase enzyme. So these are the medicines which are inhibitor of acetylcholine esterase enzyme. So by inhibiting acetylcholine esterase enzyme, so medicines will go inhibit this enzyme. So by inhibiting this enzyme, what will happen? Acetylcholine will stay in the body. Acetylcholine will stay in the body for a long time. So acetylcholine esterase enzyme is blocked. When you block this enzyme, acetylcholine will stay in the body for a long time. And when this acetylcholine will stay in the body for a long time, this acetylcholine can act on nicotine N receptor. This can act on nicotine M receptor, and this can also act on muscarinic receptor. As I have understood, directly acting medicines are given to stimulate mainly muscarinic receptor, but indirectly acting medicines are non-selective. When they inhibit acetylcholinesterase, now the acetylcholine will increase in the body. Now all the three receptors can be stimulated by indirectly acting medicines. Right, guys? Right, guys? Okay, now let's start with medicines which are directly acting. So if we talk about directly acting medicines, the first medicine that belong to this class is known as bithenecol. First medicine that belong to this class is known as bithenecol. So bithenecol is a medicine that belong to this class. First medicine which is directly acting is known as bithenecol. So from this name of bithenecol, you can remember with this word cholinergic. So this is a cholinergic drug. Bithenecol is a cholinergic drug. Now, this is a cholinergic drug that will lead to dumbbells as the effect in the body, and starting with alphabet B. So this medicine is the one that is given to contract the bladder. This is given to contract the bladder. So B is for bladder contraction. So bithenecol is a cholinergic drug. Bithenecol is a cholinergic drug. This is given to stimulate the bladder. And once this medicine will contract the bladder, once this medicine will contract the bladder, this is the best medicine. This is the best medicine which will help the patient to pass urine. So this will contract the bladder, help the patient to pass urine. This is the best medicine for the treatment of atonic bladder. This is the best medicine for the treatment of atonic bladder, where the patient bladder is not contracting, right? So patients suffer from a disease where the patient bladder is inactive. पेशेंट का ब्लैडर का टोन पेशेंट के ब्लैडर का टोन इज लेस सो पेशेंट ब्लैडर टोन इज लेस patient is suffering from atonic bladder, so bithenecol is a drug of choice for atonic bladder, and this is the medicine that is also considered as drug of choice for post operative, like after the surgery. If the patient has difficulty in passing the urine, we call it retention of urine. So this is the drug of choice for post-operative retention of urine. This is the drug of choice for atonic bladder. So guys, in both cases, whether the patient suffer from atonic bladder or patient suffer from retention of urine, in both cases, if we contract the bladder, if we contract the patient bladder, patient is easily pass the urine, and when the patient is able to pass the urine easily, bithenecol is a drug of choice. It's a best medicine to stimulate the patient bladder, that is given for atonic bladder post-operative retention of urine as well. Now we have a second medicine which belong to this class. Second medicine which belong to this class, which is a directly acting medicine. The second medicine is pilocarpine. So we have a second medicine that belong to this class. The drug name is pilocarpine. Now guys, pilocarpine is a medicine. Pilocarpine is a medicine. This drug can be used by oral route. So this medicine can be used by oral route, and when this medicine is given by oral route, this medicine is given to stimulate the secretion of glands. So this is the medicine that can be given to stimulate the secretion of glands. So pilocarpine is a drug that can be given by oral route. So if I give this medicine by oral route, this can increase the secretion of glands. That's a dumbbells. So dumbbells as the effect, secretions of glands will increase. If you see this pilocarpine, even in the name of pilocarpine, you can find the word cholinergic. Like if you go in reverse order, you can find the alphabet COLI. So this pilocarpine is a cholinergic drug. This medicine can stimulate the secretions of glands. And because this medicine can stimulate the secretions of glands, I can use this medicine for the treatment of dry mouth. I can use this medicine for the treatment of dry mouth, that is xerostomia. I can use this medicine for the treatment of dry mouth. I can also use this medicine for the treatment of a syndrome. We call it Sjogren syndrome. So who will tell me guys what happens in Sjogren syndrome? So medicine is given for the treatment of Sjogren syndrome, dry mouth, where the patient's secretions are low. So Sjogren syndrome, dry mouth, patient secretions are low. And when the patient secretions are low, this medicine will help in increasing the secretion, and we can use this medicine for dry mouth and the Sjogren syndrome treatment. Now we have eye drops of this medicine available. So pilocarpine eye drops are also available in the market. So medicine eye drops are also available in the market. Yes, Niharika, Sjogren syndrome में ना, what is the problem in Sjogren syndrome? Can anyone tell me? Yes, Sjogren syndrome में we have antibodies. antibodies are stimulated against our glands. So against our glandular cells, antibodies are acting. So our body immune mechanism that has formed the antibodies, these antibodies are destroying the glands. So just think about any gland of the body. You just think about any gland of the body. So that gland is inhibited, and accordingly you can find out the symptoms. Accordingly, you can find out the symptoms. Like if I say my salivary glands are destroyed, so patient will have dry mouth. My tear glands are destroyed. Patient will have dry eyes. Right? My sweat glands are destroyed. Patient will have the dry skin. So accordingly, it's an autoimmune disorder where all the glandular secretions are decreased. So this medicine can be given to increase all the secretion. So this is given for Sjogren's syndrome, given for dry mouth. Now, one medicine indication, the drug is given in the form of eye drops. This is given in the form of eye drops. And when I use this medicine in the form of eye drops, this medicine will start with the word PI. This medicine can make the pupil pinpoint. So pinpoint pupil means very small size pupil. So this medicine can make the pupil pinpoint. This will make the pupil very small, pinpoint pupil, small size pupil. And when this medicine will make the pupil small size and pinpoint, I can use this medicine for the treatment of a disease that is known as acute attack of. I can use this medicine for the treatment of acute attack of angle closure glaucoma. I can use this medicine for the treatment of acute attack of angle closure glaucoma. Now, this particular indication is not important for your exam. Like guys, in your dentistry exam in last 5 or 7 years, not even a single MCQ has been asked on eye drops. So they have not asked any eye drop in last 6 or 7 years exam. So anything which is related to eye drops is less important for your exam. Like this is one of the indication of pilocarpine that this can make the pupil pinpoint and can be given for angle closure glaucoma. So this indication is less important. The above indications are very important because that is something related to your dentistry. It is given for dry mouth, given for Sjogren's syndrome. The drug name is pilocarpine. Now we have a third medicine. Now we have a third medicine that is also used clinically. The medicine name is cevimeline. The medicine name is cevimeline. Now cevimeline is a medicine. Cevimeline is a medicine that will also act on muscarinic receptor, and by acting on muscarinic receptor, this medicine can also increase the secretion of glands. This will also increase the secretion of glands, and this is overall considered as drug of choice for xerostomia. This is overall considered as drug of choice for dry mouth. Overall considered as best medicine for dry mouth. So this is the best medicine for dry mouth, best medicine for xerostomia. The drug name is cevimeline. So this will also act on muscarinic receptor, result in dumbbells, and because of dumbbells, this is given for dry mouth and xerostomia. So three medicines we have covered. One is pithanicol, directly acting, act on muscarinic receptor. We have covered pilocarpine, that is given for dry mouth, and we have covered cevimeline. This is given for dry mouth. Now, guys, let's talk about the second class of medicines which are indirectly acting. So, medicines which are indirectly acting, this is acetylcholine esterase enzyme inhibitor. Increase the level of acetylcholine in the body. Now, acetylcholine will act on nicotine N receptor. Acetylcholine will act on nicotine N receptor, and this will help in improving the patient memory. So this will help in improving the patient memory. And when this will help in improving the patient memory, these medicines are given for the treatment of dementia. So medicines can be given for the treatment of dementia. Dementia is a disease where the people suffer from memory loss. So people will suffer from loss of memory. We call it dementia. So medicines are given to increase the patient memory. Medicine is given for dementia. And guys, let me tell you, there is a disease where the dementia is very common. Where the dementia is very commonly seen, the disease is known as Alzheimer's disease. So Alzheimer's is a disease where the patient suffer from acetylcholine deficiency. So patients suffer from acetylcholine deficiency in brain. So patient will suffer from acetylcholine deficiency in brain. So A is for acetylcholine, D is for deficiency in the brain, and therefore the patient memory is lost. Patient memory is lost, And the drug of choice to treat dementia. Drug of choice to treat dementia is donepezil. So donepezil is a medicine. This is the best medicine to treat dementia. So donepezil is a medicine which is the best medicine to treat dementia. So please remember guys, donepezil starts with D. Donepezil starts with D and this is given for D dementia. So donepezil starts with D. This is given for dementia, right? Pilocarpine starts with PI. Make the pupil pinpoint. Bethanecol starts with B. This is given for B bladder. So B is for bladder, P is for pupil, and D is for dementia. So donepezil given for dementia as a drug of choice. Now we have guys nicotine M receptor in the body. Now the medicines will stimulate nicotine M receptor and these medicines can improve the patient muscle strength. Medicines can improve the muscle strength of the patient. So by acting on NM receptor, these medicines can cause muscle contraction and improve the muscle strength of the patient. And when these medicines improve the muscle strength, these medicines are drug of choice. Drug of choice for a condition, best medicines for a condition where the patient will suffer from muscle weakness. Patients suffer from muscle weakness. The condition is known as myasthenia gravis. So condition is known as myasthenia gravis, where the myasthenia is known as muscles and gravis is known as graveyard. So muscles are gone into the graveyard. कब्रिस्तान में चली गई है muscles, right? So muscles are in graveyard, muscles are weak, and if you want to increase the strength of these muscles, you have to give these medicines. So these medicines, by increasing acetylcholine, this will act on nicotine M receptor, improve the muscle strength. Medicines are given for myasthenia gravis. The medicine name is pyridostigmine. So pyridostigmine is a medicine. This is the best medicine for the treatment of this condition, that is myasthenia gravis. So pyridostigmine is a drug of choice for myasthenia gravis. Students, remember like this way. In pyridostigmine, we have a word dosti. So dosti is a word, like if you are from North India or from the middle part of India, you must be knowing dosti is a Hindi word which is used to make friends. Like so, whenever you want to make friends, it means in Hindi we call it that we want to make dost. But if you are from down south, Kerala or Tamil Nadu, then you would not be knowing this word, right? So this mnemonic is for people who know this word, like dosti. So dosti is a word that we use whenever we have to make friends, right, guys? So just remember like this way: if you don't have the strength in your muscles, if you don't have the strength in your muscles, then you cannot extend the hand of friendship. If you really want to make friends in your life, you have to extend the hand of friendship, shake the hand with that person, and this requires the strength of the muscles. But if you don't have the muscle strength, you cannot make friends in your life. You cannot make dost in your life. So take pyridostigmine. So take this pyridostigmine. This will help to make dost in your life. Yes or no, guys? Am I right or not? If you want those, if you want to make those in your life, then you should have strength, you should have guts, right? You should have strength in your hand. The boys must be knowing. The boys should have strength in their hands. Yes or no, boys? All the boys, doctor here, all the males. Don't you think you should have strength in your hand to make those? Okay, next is guys. These medicines which can improve the muscle strength, they are drug of choice for myasthenia gravis. These medicines are also be used for the recovery of muscles. So here we have a drug neostigmine. Here we have a drug neostigmine. So neostigmine is a medicine that starts with the word new. So guys, please remember the drug starts with new. New generations, new people, new things are always fast. So this is new and the new things are always fast. So please remember new generation mobiles, new generation TV, right? Right? So everything is fast. New generation, like you people are Gen Z generation, right? So you are the Gen Z, you people are fast generation. My generation people are slow, like we people were slow at our time, right? So new generation people are fast generation. So this drug is starting with the word new. So this is the drug which has a fast onset of action. And because of the fast onset of action, we use this medicine. we use this medicine for the recovery or for the reversal of the, these medicines are used for the reversal of the skeletal muscle relaxant after surgery. So guys, we have a drug group we discussed already, skeletal muscle relaxants. So we have a skeletal muscle relaxants. These medicines end with the word curium or curare. And we discussed already, these medicines are blocker of NM receptor, and we can use this medicine during surgery to paralyze the muscles. So whenever we have to do the surgery, we don't want that patient should move his limbs. So we want to paralyze the muscles during surgery. And if we want to paralyze the muscles during surgery, we give skeletal muscle relaxants during surgery. Now, after the surgery is over, we want the reversal of the effect. We want to reverse the effect of skeletal muscle relaxant. Now you want to stimulate this NM receptor. So during surgery, you block this receptor so that patient is not able to use or move his limbs. But now you want to stimulate this receptor because now you want that patient should use his muscles, and now you can shift the patient to post-operative room. Now that is possible by giving neostigmine. So neostigmine is the best medicine for the reversal of skeletal muscle relaxant that is seen, that is required during surgery. And why this drug is used? Why not pyridostigmine? The reason is this is a faster acting medicine. And because this is the faster acting medicine, we can use this medicine for this purpose. Now, neostigmine, which can improve the muscle strength, this is also considered as drug of choice. Drug of choice to gain the muscle strength, to gain the muscle strength that is reduced after snake bite. So after cobra bite, after snake bite. So whenever the patient is bitten by cobra, whenever the patient is bitten by cobra snake or the snake bite, right? So even the cobra venom, the venom of the cobra will block the NM receptor. The venom of the cobra will block the NM receptor. And when this NM receptor is blocked, any person who is bitten by cobra, all muscles of the patient get paralyzed. Patient cannot breathe. Patient cannot walk. Patient cannot come to the hospital. So patient get paralyzed. All muscles get weak because of the venom spewed by this cobra in the patient body, right? So this is the cobra bite case, and when you want the recovery of this cobra bite patient, we can use the fast acting medicine, that is neostigmine, right? Although they will ask you what is the treatment of choice. So treatment of choice in cobra bite is anti-snake venom. So we have to give anti-snake venom as the first thing. So first of all, we have to neutralize the venom. So once we neutralize the venom of the cobra, then this is the best treatment. But after anti-snake venom, if we want to give some drug, that drug will be neostigmine. So neostigmine, right? It's a new medicine. It's a new medicine. This will give new life to the patient. After surgery, this will give new life that patient can use his limbs. And this is given to counter the effect of Nag Devta. So N is for Nag, right? N is for neostigmine. So N is for Nag, N is for neostigmine. This is given for Nag bite, cobra bite, right? His. Okay, now we have a drug belong to this class. The drug name is edrophonium. So we have a one more medicine belong to this class. The drug name is edrophonium. Now we have a drug edrophonium. The edrophonium is a drug which is having our drop. So guys, please remember this medicine action will drop. This medicine action will drop in few minutes. So the property of drug is this is very short acting medicine. So edrophonium is a drug which is very short acting medicine. Its action will drop at a very fast speed. And because this medicine action will drop at very fast speed, the drug is having a word edrophonium, having a word drop, so action will drop at a faster speed. So I will use this medicine for diagnosis of myasthenia gravis. I can use this medicine for diagnosis of myasthenia gravis. Like I will not use it for treatment because of the shorter action. I will use this medicine for diagnosis of myasthenia gravis. So I can use this medicine for diagnosis of myasthenia gravis, that is edrophonium, right? And pyridostigmine is a medicine, that's a drug of choice. It's a longest acting medicine here. So pyridostigmine is longest acting. So longest acting ko we use for treatment and shortest acting ko we use for diagnosis. So this is given for diagnosis of myasthenia gravis, edrophonium, right? The test is known as ameliorative test. The test is known as ameliorative test of myasthenia gravis. right? So test is known as ameliorative test of myasthenia gravis, that is useful for diagnosis of myasthenia gravis. The drug that is used over there is adrophonium. Now, guys, we have a drug which is indirectly acting and it is given to stimulate the muscarinic receptor. So we have a drug, guys. The drug name is physostigmine. So physostigmine is a medicine. Physostigmine is a medicine. This medicine is given to stimulate the muscarinic receptor. And because this medicine stimulates muscarinic receptor, this is the drug of choice. This is the drug of choice for atropine poisoning. This is the medicine of choice for atropine toxicity. Right? So guys, please remember atropine is a drug that starts from alphabet A. So please remember atropine is an anticholinergic drug. Atropine starts with A. This is an anticholinergic drug. And because this is an anticholinergic medicine, atropine, this medicine can block the muscarinic receptor. This medicine is a blocker of muscarinic receptor. So any patient who has got atropine poisoning, any patient who has got atropine toxicity, anticholinergic poisoning, his muscarinic receptor is blocked. And when the muscarinic receptor is blocked, you want to open up the receptor. So if you want to open up this receptor, you have to give physostigmine. Physostigmine open up this muscarinic receptor. This is the best medicine for atropine toxicity or atropine poisoning. Now guys, atropine is a drug. Atropine is a chemical which is present in the extract of datura fruit. So this atropine poisoning is also known as datura poisoning. So atropine poisoning, also known as datura poisoning, because the datura is a poisonous fruit, and if you consume this fruit, or basically human to nahi consume karte, animal consume this fruit. So the animal will consume this fruit, right? So the extract of datura contains atropine. So datura poisoning, atropine poisoning is same thing. Now atropine is a drug that we get from a belladonna plant. So the atropine we get from a plant. The name of a plant is belladonna. So this is also known as belladonna poisoning. This is also known as belladonna poisoning. So atropine poisoning, datura poisoning, belladonna poisoning is more or less same thing. So atropine poisoning, datura poisoning, belladonna poisoning, muscarinic receptors are blocked. So what are the symptoms? What are the symptoms of atropine poisoning, guys? Answer is patients of atropine poisoning, patients will have symptoms which are opposite to dumbbells. So patient will have symptoms which are opposite to dumbbells. Now, apart from opposite to dumbbells, patient's CNS gets stimulated. So patient will have symptoms which are opposite to dumbbells that you can find it by yourself. Apart from that, patient's central nervous system will be stimulated. So patient's central nervous system will be stimulated and patient can have the seizures and hallucinations. So patient can have seizures and hallucination when the CNS is stimulated. So guys, again, I would say if you are from North India, you people understand little bit of Hindi, then this mnemonic is for you. That is physostigmine is having a word susti. So physostigmine is having a word susti in its name. So who will tell me, guys, if you are from North India or if you understand Hindi, what is the meaning of the word susti in Hindi? So this medicine gives you susti. So what is this susti means? Like what is this effect? So I'm saying atropine poisoning में patient will have the symptoms opposite to dumbbells plus CNS is stimulated, right? CNS is stimulated. So what is the meaning of the word susti in Hindi? Yes, this is laziness, drowsiness. So this is the medicine that will suppress the CNS. This is the medicine that will suppress the CNS. I really salute to Shilpa, Dr. Shilpa Kajal. She has said the susti means bronchospasm. Okay, maybe in some language susti means the bronchospasm, but in Hindi the susti means CNS suppression. CNS suppression is the word is susti. So guys, please remember there are two medicines which have confusing names. One is known as pyridostigmine, one is known as physostigmine. So how will you remember these medicines, guys? How will you remember these medicines? One is pyridostigmine, one is physostigmine. So guys, please remember in pyridostigmine, we have a Hindi word dosti. So I'm so sorry for the South Indian people who cannot understand these kind of mnemonics. But I have many English mnemonics also, right? So gradually we will use the English mnemonic also, right? No problem at all. So by chance the two Hindi mnemonics have come first. Sorry for that. So dosti, we want to increase the muscle strength. That is a dosti. This is given for muscle weakness, myasthenia gravis. Neostigmine starts with N. This is given to reverse the effect of Nag Devta. Right? This is given to counteract the effect of Nag, and it is a new medicine, fast medicine, and we require the fast action after surgery for the recovery of the patient. Adroponium action will drop very fast. It is given for diagnosis. That's a ameliorative test. And we have a drug physostigmine. This is a CNS suppressant medicine. Can reverse the symptoms of atropine poisoning, belladonna poisoning, datura poisoning. So these are the medicines which we have covered. These medicines are indirectly acting medicines. Now, apart from these medicines, there are some poisons for human being. So apart from that medicines, there are some poisons for human being. We call them cholinergic poisons. So we call it cholinergic poisoning. So patient can have cholinergic poisoning, right? So the poisons which are cholinergic poisoning, patient will have the same symptoms like dumbbells. So patient will have the symptoms like dumbbells. So poisons may cholinergic poisoning, patient will have the symptoms like dumbbells, right? So what are the examples of poisons? One is known as organophosphate poisoning. One is known as organophosphate poisoning. One is known as carbamate poisoning. So we have a organophosphate poisoning, carbamate poisoning. These are the two poisons that we use in insecticides, that we use as insecticides and pesticides, that we use as insecticides and pesticides. So these are the insecticides and pesticides. So these are the insecticides and pesticides, organophosphates and carbamates. So uh, whenever we people consume insecticides and pesticides, like mostly seen in village area. So in village area at evening time, like this time, 7:30 p.m., when the persons get tired like this way, they are tired by doing all the hard work of the day. They want some tonic in night. They want some tonic in night. So they when they consume this 30 ml of tonic, after taking 30 ml of tonic, they don't they cannot recognize with the uh, your tonic bottle with the insecticide bottle. So by mistake, instead of having a 60 ml tonic, they will take carbamates or organophosphates. So this poisoning can be seen in village area where the organophosphates and carbamates are stored in house and used as insecticide pesticide. These are the two chemicals which are inhibitor of acetylcholine esterase enzyme. They inhibit acetylcholine esterase enzyme irreversibly. So they are the irreversible inhibitor of acetylcholine esterase enzyme. And by inhibiting this enzyme irreversibly, acetylcholine will stay in the body for long time. And when this acetylcholine that will stay in the body for long time, this acetylcholine is keep on acting on muscarinic receptor and keep on causing the same symptoms as dumbbells. Keep on causing the same symptoms as dumbbells. So patient will have the same symptoms as dumbbells. I hope you know the full form of dumbbells. The only thing you have to remember is you have to remember is the E stands for epilepsy here. Guys, you have to understand E does not stand for erection in the poisoning. Poisoning means the patient is on the deathbed. Patient is dying. So at the time of death, patient cannot have the erections. Even you can understand, na? Nobody has a last will ki sir, when I die, I want to have sex. So your last wish cannot be to do the sex, right? So you cannot have the sexual arousal at the time of poisoning, right? So dumbbells may E stands for epilepsy. So patient will have diarrhea, dilatation of blood vessels, urination, meiosis, bronchospasm, bradycardia, plus epilepsy, lacrimation, salivation, and sweating. So these are the symptoms of organophosphate poisoning and carbamate poisoning. And we have to reverse this effect. So what is the antidote that we use? So the antidote of choice is atropine. So atropine is an anticholinergic drug. Atropine is an anticholinergic drug, right? So this is a blocker of muscarinic receptor. This is the blocker of all muscarinic receptors. So this is an anticholinergic drug, atropine. This is the best medicine of choice for organophosphate and carbamate poisoning. This is the best medicine of choice for organophosphate and the carbamate poisoning, antidote of choice. But organophosphate poisoning, in organophosphate poisoning, we also use one more drug that is known as oximes. So we also use one more drug that is known as oximes. So students, make the mnemonic: organophosphate poisoning, we use oximes. In organophosphate poisoning, we also use a group of medicine, we call them oxime. One of the example of oxime is pralidoxime. So one of the example is pralidoxime. So organophosphate poisoning, we starts with letter O. We also use the group of medicines, we call them oxime. And these medicines help in enzyme reactivation. These medicines help in enzyme reactivation. But medicines are most of the time not successful. So medicines only have the supportive role. Medicines only have the supportive role. They are not the main medicines. They only have the supportive role. They help in the enzyme reactivation. But the main drug that will save the life, the main drug that is a life-saving medicine is atropine. Atropine is the one that will control the above symptoms. So atropine is the antidote of choice. Oximes are only be useful for supportive treatment, and these oximes are not useful. These oximes are not useful in carbamate poisoning. So guys, please remember, O is for O. Oximes are given for oxime. Oximes are given for organophosphate poisoning, not given for carbamate poisoning. So oximes are given for organophosphate poisoning, not given for carbamate poisoning. This is what we people have discussed in this poisoning. So this is poisoning related to cholinergic drug, and we have discussed about the clinically useful medicines in detail. So uh, in this session, like we have just about to finish the session of 2 hours. It's already been 2 hours now since the time we have started the lecture. So what we have discussed so far, first of all, we have discussed the types of nervous system we have in the body and what are the various drugs that can act on this nervous system, so that you should have a basic idea like what all topics we are going to discuss in subsequent lectures. Like we will discuss about GA drugs, we'll discuss about local anesthetics, we talk about skeletal muscle relaxant. We started with autonomic nervous system drugs. Then we discussed the types of autonomic nerves, sympathetic and parasympathetic. We started with cholinergic drugs, acetylcholine details we have discussed, Botox we have discussed, acetylcholine metabolism we have covered. Then we talked about its type of receptors and the locations of the receptors, the properties of the receptor, and we discussed the actions of acetylcholine on these receptors. Based on this knowledge, we started some drugs which are clinically useful drugs. So we have two types of medicines, cholinergic, anticholinergic. In this session, we are able to finish cholinergic drugs, which are of two types, directly acting, indirectly acting. Directly acting directly stimulate muscarinic receptor. Medicines are bithanecol for bladder, pilocarpine for pressure in the eyes. So P is for pressure, P is for pilocarpine, cevimeline for dry mouth, right? Indirectly acting, they can be given to increase the memory. So dementia starts with D, we can give donepezil. So donepezil for dementia, pyridostigmine to make the dose given for myasthenia gravis. New stigmine is new faster acting given for emergencies like snake bite or for the reversal of skeletal muscle relaxant. Edrophonium action will drop very fast given for diagnosis. The last is we covered physostigmine having a word susti. So this medicine suppress the CNS. So given in those conditions where the CNS is overactive, that is atropine poisoning, belladonna poisoning, or datura poisoning. Toxicity associated with cholinergic drug is known as organophosphate poisoning, carbamate poisoning. Symptoms are dumbbells. The antidote of choice is atropine, and we can also give oxime for enzyme reactivation. So this is what we have covered about cholinergic drugs. Now we'll take a break now, and we'll after the break we will start to talk about anticholinergic drugs. Now many of students have joined us in this YouTube session, and this was free to air. The session was free to air. This was available for all of you. So guys, after that, in case you have any doubt, you can directly message me on this number. You can directly WhatsApp me on this number in case you have any doubt, right? And also, guys, you people can join my group, my Telegram group, that is Pharmacology by Dr. Saurabh Bhatia, right? So my name is Saurabh Bhatia. So if you want to have daily quiz you want to attend, you can join my Telegram group, Pharmacology by Saurabh Bhatia. And guys, the students who are the part of this session, I hope you have liked this pharma lecture. This is what our approach in DBMC 1 is, right? We people teach like this way. We people go with the concepts. So you should have the you should have a good command over the subject. So that like in case they ask clinical question, they ask question from any concept, anywhere from the topic, you will be able to answer all these questions. Plus, we also cover these mnemonics so that this will also help to recall the drug names. Because in pharma, the basic challenge is the drug names. The concept is very interesting. With pharma, mein, the best part is the concept is very interesting because we have to treat all the patients. So when you treat a patient, this gives a feeling of fulfillment. This gives a feeling of satisfaction that we are doing something for someone else, right? So pharma concept is interesting. The only part is the drug names are boring. So that will mug up with the help of various mnemonics. So guys, with this, I would say, in case you are interested, you can join these batches. And the students who have already joined us, we will continue the lecture after the break. And now I will interact on the Telegram group. Right. So we have a DBMC official Telegram group. In case you would be having any doubt, you can put there and we will interact over there now. This YouTube session is going to end over here. Take care, guys. We'll meet soon. See you soon again.